Alright guys, welcome back to W.D.Y.D CSP. What do you do as a central sterile processor? Alright guys, we are going back to basics and we're talking about osteotomes. Alright, osteotomes. What I have here right now is a curve-shaped osteotome and a straight. Those are the varieties. You have angled ones as well. Okay. They come in a variety of shapes and sizes. This one happens to be a Lamboat osteotome. You can have cob style handles, hexagonal, plastic handles, etc., etc. Osteotomes, as the name implies, osteo mean bones, tome, T-O-M-E, cutting into or segmenting. It's used to take pieces of bone, chip off or cut into bone. They are extremely sharp instruments and require precise repair, inspection, and testing. Okay, and we're going to go over all of that in the video. Of course, you want to inspect your device for cleanliness and the entirety of the device, looking for pitting, any excessive scratching, staining. These take a host of abuse on the field. Hammers can be used to chisel into hard bone, so you'll see some scratching or mushrooming of the device at the end if it's used with a hammer. So you want to observe for sharp edges along that instrument that isn't the actual working edge. Okay. Now you want to look at the working edge there. Now I do not recommend that you do what I just did with your finger and checking for the sharpness, in that, you know, these are extremely sharp and you have to be careful when handling them. For you guys that like to dig into trays, please be real careful to make sure you're not grabbing these by the distal tip or the working end, because they can easily cut you and you wouldn't even know it. All right, if you have, depending on who's your repair company, they should have some kind of testing material for you for osteotome. This company here, I mean, not promoting them or anything like that, but this is a very, very, very handy testing kit. And I'm going to show you what they have here for the testing of the osteotomes, or your knives, your curettes, your sharp edge devices. Okay, it's a little dowel rod here. So the neat thing about this little book here is that it actually shows you, looking for it now, there's a section here on how to test osteotomes. All right, so it gives you the precise angle that you need to be at, to the dowel to test it, and a description of what you're testing for. Now, of course, you want to inspect your device for cleanliness, but you also want to inspect your device for damage. Okay, so when you're looking at the instrument, you want to use your magnifier to look at the working end to see if there's any chips or bends or damages. Okay, if you find an instrument that has damage, okay, there's no reason to test it, to go any further. That instrument needs to go out for repair. So I hope you can see this on the camera. The edge of this thing is chewed up. You see the little bends and the chips in there. It's a little bent area there on that instrument. It's still sharp, Don't get it twisted. It's still sharp and still can damage, but this is not a good instrument and it's not going to perform on the field the way the surgeon needs it to perform. So you need to put that instrument out for repair and replace it with one that is in good condition. All right, so when you test your instrument on your dowel rod, okay, I teach individuals, please do not grab the dowel rod with your thumb and index finger as shown here. Okay, because if you're testing the device and it happens to slip, you can wind up cutting into your thumb. Instead, take 2 or 3 fingers and hold the proximal end of the dowel rod nice and firm. Okay, rest that osteotome on your finger just like you would a pool stick on your fingers when you're playing pool, right? So you're using your fingers as a resting spot for the osteotome, and then you're gonna Of course, this is the curved one. You're not going to curve up. It's going to be curved down. Okay, fingers out of the way, and you're going to try to bite into that dowel rod. Okay, you should be able to bite on it and not slide back and forth. It should be a very quick and easy bite. You're not trying to dig into this dowel rod, but as you're doing that, as you can see, okay, be careful when you're cutting into it. I told you it's sharp. There's going to be residue from that dowel rod because you're cutting into it, right? Okay, so what you do is grab a little cloth and just wipe off the testing material. Okay, there's no need to send this instrument back to decon to clean. Just make sure that you remove the testing material. Okay, same thing with the straight. Use your fingers to firmly hold down the dowel rod and try to bite into this rod, right? Okay, again, when you do that, you're going to remove little pieces of material. You see that right there in the camera? That is a piece of the dowel rod. You don't want that in the set. Okay, that is foreign materials, not microorganisms. It's not bioburden. It is foreign material that's going to go into the tray. And if that lands in the patient, there is a possibility, there's going to be an infection. Not a possibility. If it lands in the patient, you will cause a surgical site infection. We don't want that, right? Okay, so again, hold that dowel rod away from your fingers, check your material, wipe off excess off of your instruments, and that's how you test and inspect osteotomes. All right, guys, as always, stay true to yourselves, keep it 100, continue educating yourself. Until next time, peace, guys.